My name is Jean-Frédéric Levesque. I'm the Chief Executive Officer of the Agency for Clinical Innovation. Well, I was trained as a medical doctor in Canada, and then I got interested in research, did a PhD, and then got really interested into healthcare systems and how they work, how they can actually achieve coverage of the entire population in terms of needs, but also how they change. And that really led me to have an interest in various public sector organizations and really try to contribute to improving healthcare in the public sector. Well, I think innovation has always been very critical to healthcare systems, both in the public and the private sector. We're talking about constant change in terms of the types of treatments that we can actually give to patients. Increasingly also we're thinking about new ways about how to deliver and organize care. And therefore, the healthcare system is a very dynamic system that constantly needs to look for new ways to deliver care. And the reason is that there's lots of different things that currently we struggle to do for patients, and we really need to find better ways to engage patients into care, but also make sure that we can actually integrate those new technologies and find systems that can support them for the benefit of patients. So there's lots more to do, a lot more needs that need to happen, and innovation is really key to find those new solutions. Healthcare systems are very complex. We're talking about different sectors, some of them being in the hospital sector, being the community-based organizations, primary care sectors, etc. And there's a lot of different professionals involved in treating patients. Patients are complex themselves. They've got various needs, various expectations, and making this all work together is not an easy thing to do, and various systems around the world are struggling to really integrate. Information and transferring of information between sectors is really key. Making sure that we have shared governance structures between those sectors is also really fundamental, and ultimately really focusing on the patient's journey, really trying to put in place systems that can actually help to make that journey more integrated is really, really key. So a very complex system, and it does require various types of approaches to try to make it better integrated for patients. There is a lot of work happening at the moment to really make care patient-centric in various fields. And in the space of aged health, for example, we're also talking about making a connection between healthcare systems and the delivery of healthcare with the other environments into which older patients are actually evolving. And this really means that we need to better think about how to integrate the provision of care into the new living areas for patients. It can be nursing homes, it can be multi-purpose services, and increasingly try to make some healthcare settings where older people live increasingly feel like home. And that really requires an integration between acute care, social care, and other dimensions to really, provide a all-of-person approach for older people. I think that the event has been great in terms of how the different speakers so far have provided complementary perspective around something complex and that system change. So personally, I learned about hearing about the different perspectives. System change is a complex process, and therefore you need to look at different ways to look at system change and better understand how the patient's perspective, a safety perspective, and organizational change perspective can actually support transformation, again, to provide better care for patients.